and the attorney had asked me, um, after I went through the narrative report and everything with him, was I going to continue to treat the patient because I had recommended that the patient needed care, ongoing, you know, 2 times uh, per month. And I kind of didn't know how to answer that. So I was wondering if um, you could help me out with that because I know that, we at the end of care we make the recommendations for treatment, but since this is I'm doing a case financial driver instead of it being specifically my own patient, I didn't know quite how to respond to that.
Yeah, that's a real important question. There's a couple things that are real important that actually hurt the case, and this is one of them that hurts the case is when the patient finishes care, goes MMI, but usually when and they stop getting care, that actually hurts the case. Usually they stop getting care because the PIP has run out or the payments have run out. That's usually the reason. So it is a dilemma. But the short answer is yes. If whoever their primary care provider was, if they're not going to continue treat them, then your answer is yes. Then yeah, you'll definitely treat them and just take it on an LOP is what you should do. But when be but it be just be aware there's it hurts the case. Um, let me share with you if they do not get some periodic treatment. Now, if they don't, make sure you document it. What you don't want is them not to get care at MMI and you don't document it, and then they're not showing the need for care. And then that shows up. See, that's bad. I mean, just think of it. It's just common sense. It just doesn't make sense, to have a go to MMI and need periodic care, and then you don't even get care. So you want to at least recommend it to the patient. And if they don't get the care, then you want to document why they did not. And usually it's because of money, and so document that. Document that I recommended care. The patient stated they couldn't afford care and there was no further payments. And so that was the reason the patient gave for not continuing care. See, that's a legitimate reason. People understand that. A lot of people don't get health care because of cost. So that's the answer to that. Is yeah, you want that patient under some kind of periodic care at least until the whole thing settles. Does that make sense?
Yeah, it does make sense. It makes a lot of sense, Doc. When you
But my
said
my
about,
question, but my question to you is, why would you not?
I would say my answer in the past would be because I was so accustomed to discharging them from care
Well,
in the past.
wait a minute. You just charged them for care because without MMI and an impairment, didn't you?
Yeah, yeah,
See, well,
because I was
that's wait a minute. That's totally different, right? If they don't have an impairment, there's no need for future care, right?
right, right,
So you didn't give an impairment, so there was no need for future care. So you discharged them, and that's true. If they don't have
right,
an impairment, there's no need for future care when you discharge them.
right, right, right.
But if you're going to give
Okay.
an impairment rating and give those suggestions, then you better talk to that patient and make sure they understand that they need to get some type of periodic care, not just clinically, right? Not just clinically, but administratively, meaning that it'll actually hurt their injury award.
But Doc, you mentioned about financing. If you're already treating them on a lien, how would finances
Then
be a
let it
problem?
go. Then just keep going. You're fine. You've
Okay,
got LOP, you're fine.
okay, okay.
But can you see how that's a problem when you say there's an impairment rating and you suggest, X amount of care and then the patient doesn't do any further care? Can you see how that
Yeah, yeah. And that's what the attorney was saying. He was like, "Hey, are you still treating them?"
remember what is always the definitive answer? You have any question in personal injury, what is always you're going to bounce it against? What's the answer? You're always going to bounce it against what?
Eighth grade educated jury.
Eighth grade educated jury. Well, how the hell does that sound to an eighth grade educated jury that they got an impairment rating? You met recommended twice a month. They didn't get care, and you've got no documentation saying otherwise. What does that look like? You're on the jury. What's that look like to you?
Looks bad.
That's right. So even if they don't get care, that's not a problem as long as you document it. And it's usually a legitimate reason. It's usually they can't afford care. They don't have the time. They got to work. They got to take off from work. See, those are legitimate reasons that a normal person would understand. So there's nothing wrong with if the patient doesn't do what you say. What's wrong is if you don't document it. That's when it's wrong.